Hi.
Hi. Hi, Assalamualaikum.
Hi. Assalamualaikum. Hi.
My name is Wanur Ilahi binti Muhammad Azmi.
My name is Nur Sakina Ahmad Safwan.
So my name is Nur Kaisa Uzma binti Muhammad Yusuf.
My name is Farizah Rahmatullahi.
My name is Nushafa binti Ibrahim.
My name is Siti Naradira binti Muhammad Taufik.
We are
From
PA 2353B.
We are from Bachelor of Health.
session.
our group will
We presented on
The urinary system.
Did you know urinary system? The urinary system is also known as the renal system or urinary tract. It consists of kidneys, the ureters, the bladder, and the urethra. We go to the function of urinary system. Firstly, the function of urinary system is maintaining the proper balance of water, salts, and acids in the body by filtering the blood as it flows through the kidneys. Next, it constantly filtering the blood to remove urea, creatinine, uric acid, and other water material from the bloodstream. And lastly, the function of urinary system is converting these waste products and excess fluids into urine in the kidneys and excreting them from the body via urinary bladder. And the major function of urinary system is work with the other system of the body to help maintain homeostasis. Kidneys are the main organs of homeostasis. Now, have you understand what is homeostasis? Homeostasis is a key concept in understanding how our body works. It comes from two Greek words, homeo meaning similar and stasis meaning stable. More formal definition of homeostasis is the tendency to resist change in order to maintain a stable, relatively constant internal environment. Homeostasis is happening constantly in our bodies. We eat, sweat, drink, dance, eat some more, have salty fries, and yet our body composition remain almost the same. No matter if you drink much water, your body doesn't swell up like a balloon. And if you drink very little, it doesn't shrivel like a raisin. Our bodies know how much fluid we need to keep and then maintain a constant level regardless of how much water we drink. This maintenance of body size is an example of homeostasis.
Nephrologists and urologists can treat kidney-related conditions. It can be easy to confuse the services of nephrologists and the services of urologists. These specialties of medicine often overlap, and you may need to see both for the same condition. So, how are they different, and when should you see one instead of the other? Let's take a look. The first one is nephrologist. So, nephrologist specializes in diagnosing and treating diseases or disorders of kidneys. Its main focus is diagnosing and managing diseases that affect the way your kidneys function. There are a variety of services that a nephrologist can offer, such as monitoring blood pressure, monitoring fluid and electrolyte balance in the body, and also dialysis treatments. Some of the reasons you may be referred to a nephrologist. And they are kidney failure or kidney chronic disease, hypertension, kidney cancer, and also renal failure or obstruction. The next one is urologist. Urologist specializes in diagnosing and treating diseases or disorders of urinary system of females and genitourinary system of males. Urologists focus on treating anatomical or structural problems of the urinary tract and its related organs. Areas that can be treated by urologists include urethra, bladder, ureters, kidneys, adrenal glands, penis, testes, and prostate. There are some reasons you may be referred to a urologist. They are urinary bladder problems, urinary tract infection, pelvic prolapse problems, and the problems of the male reproductive organs.
What?
Hi everyone. Now, let me explain about the pathology of urinary system. First, nephropathy. It means any disease of a kidney. As example, diabetic nephropathy. It is a kidney damage that resulted from having a diabetes. Next, renal failure. Exothermia, elevated burn due to the lack of blood flow to the kidney. Uremia, toxic condition, where urea and other waste products are retained in the blood. We also have acute renal failure and chronic kidney disease. The third one is nephrotic syndrome. First, edema is excessive fluid in body tissue. Second one is hyperproteinuria, is abnormally high concentration of protein in the urine. A stone, also known as calculus, is an abnormal mineral deposit as formed within our body. It came in two sizes, from small sand-like size that can pass through the body unnoticed to the size of marble that can become lodged and causing acute pain to our body. In the urinary bladder, we have cystalgia, cystosil, vesicoureteral reflux, and interstitial cystitis. Neurogenic bladder is a urinary problem caused by the interference with the normal nerve pathway associated with the urination. The prostate gland, known as enlarged prostate, and this disease mostly occurred to the men that older than 50 years old.
Okay, in this part, we're gonna explain about diagnosis and treatment procedure in the urinary system. First of all is urinalysis. This is to determine presence of abnormal element. The second one is bladder ultrasound. It assists with visualization of stone, elevation of bladder by enlarged prostate, or measuring of residual urine. The next one is urinary catheterization. This is an insertion of a tube into bladder to procure a sterile specimen, and the procedure must be performed under sterile conduction. Okay, next is cytoscopy. This is use of endoscope for visual examination of urinary bladder, and then voiding cystoretrography. This one is use of fluoroscope to determine flow of urine from bladder through the urethra. And then we have computed tomography. This diagnostic procedure is used for evaluation of urinary system. And then the last one is glomerular filtration rate. This procedure is a blood test for determination in filtering of blood by the kidneys. Okay, so the next diagnostic procedure is by radiographic examination. So the first one is cytography, which is X-ray examination of bladder, and then intravenous pyelography, which provide image of kidneys and ureters, and then the KUB, which assists with detection of bowel obstruction and nephrolites, and the last one is retrograde urography, which observe outward flow of urine. Okay, so among the above, only kidneys, ureters and bladder does not require contrast medium. Okay, so the next one is diagnostic procedure of prostate gland. So the first thing is digital rectal examination. This is lubricated or glove finger placed in rectum to palpate prostate gland. And then prostate specific antigen blood test. This is to screen for prostate cancer. So let's see the treatment procedure of urinary system. We have medication, nutritional intervention and dialysis. So the use of diuretic is to increase urine secretion. Antibiotic is treatment of urinary tract infection, while antispasmodic to block signal that cause urinary incontinence. Meanwhile, in nutritional intervention, this is to monitor sodium, potassium, phosphorus and protein in diet. As for the dialysis treatment, it helps to remove waste product and excess water from blood when kidneys does not function properly. It has two types of dialysis, which are hemodialysis and peritoneal dialysis. Okay, the next treatment is for nephrolites. So the first one is extracorporeal shockwave lithotripsy. This is a breaking of stone into fragments which are then excreted in urine. And then precutaneous nephrolithotomy. This is surgical removal of nephrolite through small opening in the back. Okay, we are almost there because this is the last subtopic, which is prostate treatment. So the first thing is ablation, which is removal of a body part, and then we have prostatectomy, which is surgical removal of part or all prostate gland, and then transuteral prostatectomy. This is use of resectoscope to remove excess tissue from enlarged prostate gland. And then radiation therapy and hormone therapy. This is an additional treatment for prostate cancer. The last one is watchful waiting. This is maybe prescribed approach due to slow progression of prostate cancer.